Hello everyone, this is Dr. Fady Assem. I'm here today to talk about the discharge letter. At the beginning of the session, we will have a look on the form of the discharge letter, and then we will do some sort of practice on it. So if we start by looking at my notes, you will find that the discharge letter is written mostly to the patient's GP or the patient's home nurse or the patient district or community nurse. So, in most of the cases, the patient will be discharged to his home, but you write one of these letters informing the patient's GP or his or her nurse about the management plan that you have set. So, we start the heading of the letter as usual by writing the name of the patient or the doctor, his or her specialty, the address, which is usually the address of the GP center if you are going to refer the patient to his or her GP, and the date of the exam or the date of the patient discharge date. Then we move to the introduction. In the introduction, we should clarify that this patient will be discharged. In most of the cases, the patient has been already diagnosed with condition or disease, and he has been managed in the hospital, and you are now discharging him. So you need to clarify this in the introduction, and you need to give a hint about the general plan of management for this patient. Okay, as in the example that we can read here, I'm writing to inform you regarding Mr. X condition, who is being discharged from our department into your care. He was admitted into our hospital for diabetic ketoacidosis attack or bronchogenic carcinoma management or any other diagnosis. Then we move to the first paragraph. We have two ideas here. If you are going to write this letter to the home nurse or the community nurse, you have to include the relevant medical history, medications, allergies of the patient. However, if you are going to write this letter to his or her GP, the GP always knows everything about the patient's history. So you do not have to mention any of this information. Then we move to the second paragraph. In the second paragraph, you write the details about the patient's admission. For example, when the patient was admitted, he was having or she was having certain complaint. And then you start analyzing this complaint. And if there is any specific positive findings in the examination, it has to be written. If there is positive finding in the examination, should be written as well. And then you move to the management plan of the patient. In the same paragraph, you can write the follow-up of the patient's condition. If this patient is already admitted into your hospital and you follow up his condition or his case daily, you have to write the follow-up of this patient's condition. Like the referral letter, it doesn't matter. It doesn't differ a lot. Lastly, you will write today's review or today's condition of the patient. In most of the cases, if you are going to discharge this patient, that means that his condition has improved or he is recovering from his illness. This is in most of the conditions. Also, if you change the medication of this patient, if you have done some sort of consultation, psychiatric or physiotherapist consultation, you have to mention it as well in this paragraph. Lastly, in the conclusion paragraph, you need to give the final advice or the final recommendations to the reader who is going to read this letter. I know this might sound theoretical. That's why we are going to see an example for the discharge letter case notes, and then we will read the explanation for these case notes. Okay, in these case notes, we have our patient. Her name is Sally Fletcher. This patient is having a diagnosis of endometriosis. She's having a past medical history of painful periods, and she's been trying to conceive for some time. We have her social background and her medical condition. If we look at the medical background of the patient, you will find that she was having occasional constipation associated with the pain in lower left quadrant. Accordingly, a transvaginal ultrasound was ordered, which showed that she's having an endometrial cyst. An operation was done for the patient, and on the rest of the letter, the notes will talk about the management plan after the operation. So we will find details about her showering, her driving, also about her nursing management, the type of fluid and diet that she should take, her lab investigations, her level of consciousness, as well as her discharge plan. Finally, we need to reach the writing task. What exactly and to whom should I write in this letter? You are a first-year resident in a surgical ward. Sally Fletcher is a 25-year-old woman who has recently undergone surgery. You are now discharging her from hospital. Using the information given to you in the case notes, write a letter of discharge to the patient's GP. This is really important because if I'm going to write this letter to her GP, that means all the information regarding social history, medical history should not be written. And this is the information about the patient's GP. So let's see a sample answer for these case notes. We will start here by the date of today or the date of discharge, the patient's name, his specialty, you can write it in full as a general practitioner. This is the address of, or this is the name of the surgery. In Australia, surgery is equal to the general practice. It's the same meaning. And this is the address, the full address of the patient's surgery or GP clinic. Then you write the normal heading that we are used to write. Okay, let's see what this letter is talking about. We start the letter, as we mentioned, by clarifying the purpose of this letter. You have to include general idea about the patient's diagnosis, as well as that general idea about the management plan. So what's written here that Miss Fletcher has undergone laparoscopic excision of endometrial cyst. I request you do follow up of her condition as she is now ready for discharge into your care. So I have clarified the patient's diagnosis and a general idea about what I want from the reader to do. We will not include anything about the patient's medical history, allergies, or medications because we are referring her back to her GP. So in this paragraph, we will discuss about the patient's situation upon admission. Mrs. Fletcher mentioned having painful periods for which she was taking naproxen. Upon admission, she was complaining of severe lower abdominal pain associated with occasional constipation. So I'm here precisely talking about the patient's clinical picture upon admission. So an urgent transvaginal ultrasound was ordered, which revealed the clear diagnosis that I was looking for, a 6 centimeter cyst of endometrial origin. Then we will talk about what kind of management I have done to this patient. This morning, she underwent laparoscopic surgery, which successfully located the removed the cyst from her abdomen without complications. So I'm precisely talking that this operation went uneventful. In this second or the third paragraph or body 2, I'm going to explain the follow-up of this patient or her post-operative care. After the operation, she was advised to keep the incision sites clean and dry. Analgesic was given to manage her pain, and she was instructed on the possibility of resuming driving after stopping this medication. So I'm clarifying here and rephrasing that this patient is unable to drive until she stops her analgesic medication. If you return back to the case notes, you will find that I'm here summarizing and rephrasing. And these are two criteria which are necessary in the OET writing. Then I will continue to talk about her nursing management. She was encouraged to start drinking fluids as well as eating. It is worth mentioning that all her lab investigations were normal and the patient was fully conscious and aware. Also, if you return back to the case notes, you will find that the case notes are talking about details regarding the patient's lab investigation, her hemoglobin, her liver function, her kidney function, and her bleeding profile. I do not have to mention all of these medical and clinical details in the OET exam, so I can simply say that all her laboratory investigations were normal. Then I move to the last paragraph. In the last paragraph, I have to enumerate how is the patient doing now, her current situation. As I mentioned, in most of the cases, if the patient is going to be discharged, her condition has improved significantly. She can walk independently now. Accordingly, I'm discharging her with someone who can drive her home. And I can finish my letter by asking the reader if he's having any queries that he can contact me, and I finish my letter by putting my signature here. I hope I have cleared all about the discharge letter. If you have any question, please contact me at any time. Good luck.